Hello, and welcome to this discussion about awareness of hepatitis B co-infections. I am Dr. Amy Tang, and here with me today is Dr. Joseph Ahn. I am a primary care internist and the Director of Immigrant Health at Northeast Medical Services in San Francisco, California.
Yeah, my name is Joseph Ahn, and I'm a professor of medicine and section chief of GI and a transplant hepatologist at Oregon Health and Science University in Portland, Oregon.
We are providing this information today to empower patients with hepatitis B virus to understand their disease, including the transmission, incidence, treatment, and prevention of hepatitis B co-infections, and ways to reduce their disease burden. So let's start by talking about the different types of hepatitis. Hepatitis A virus is transmitted primarily through close or sexual contact with an infected person, or ingestion of contaminated food or water. Symptoms of acute infection include fever, jaundice, which is yellowing of the skin and eyes, fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pains, dark urine, clay-colored stool, and diarrhea. There's no potential for chronic infection with hepatitis A. It really just presents as acute infection, and most people recover. However, elderly and/or those with underlying liver disease can potentially suffer severe consequences from the infection. Hepatitis B can be transmitted from mother to child during childbirth if the mother is infected, or via sexual contact or blood contact, such as sharing contaminated needles or syringes. Chronic infection is more likely when someone is infected at a younger age. For instance, 90% of infants and up to 50% of children ages 1 through 5 develop chronic infection, whereas only about 5% of adults newly infected will develop chronic infection. About 15 to 25% of people with chronic infection will develop chronic liver disease complications like cirrhosis, liver failure, or liver cancer. Now, hepatitis C is most commonly transmitted from blood-to-blood contact, such as sharing contaminated needles and syringes. Chronic infection develops in more than half of newly infected people, and up to 25% of those chronically infected develop cirrhosis. Those with cirrhosis have a 1 to 4% annual risk for liver cancer. And finally, hepatitis D is transmitted via similar routes to hepatitis B infection, and it only occurs when hepatitis B virus is present. So I want to repeat, hepatitis D infection does not occur unless hepatitis B virus is also present. It can cause acute or chronic infections, and chronic infections have a high likelihood of progressing to cirrhosis in those with chronic Hep B and D. We have talked in general about the different types of viral hepatitis infections. However, some patients may develop more than one hepatitis infection at the same time. Dr. Ahn, could you tell us more about what co-infections patients with hepatitis B may have?
Yeah, thank you, Dr. Tang, for that great overview of the viral hepatitis. Hepatitis B patients may also be co-infected with other viruses, such as we've heard, hepatitis A, hepatitis C, hepatitis D, or the human immunodeficiency virus, or HIV. When patients are infected with more than one virus, that is co-infection, this increases their risk of liver cancer, cirrhosis, and liver failure. It raises the progression of disease as well as the risk of mortality. Now let's go a little deeper into some of these co-infections. With patients who have hepatitis B, up to 30% of them have been estimated to have hepatitis C. Oftentimes, when more than one virus infects a patient, one of them can become dominant. In this case, hepatitis C can become dominant and reduce hepatitis B levels to nearly undetectable, resulting in often an underestimation of hepatitis B and C co-infections. But the impact of this is substantial on a worldwide basis. As mentioned previously, it increases the probability of progression to cirrhosis, the severity of liver diseases, and the risk of liver cancer. Furthermore, it does not spare children, as even co-infected children can develop more severe liver disease. Now, there is no vaccine yet for hepatitis C, but thankfully we have curative treatments available for hepatitis C. Treatment for hepatitis B is determined by the patient's viral levels and liver function, as well as other patient characteristics. Now, with regards to hepatitis B and hepatitis D co-infection, the estimated incidence is about 5%, although in some parts of the world, it can be as high as 15%. As we've already heard from Dr. Tang, the key important point about hepatitis D or hepatitis delta is that it can only exist in the setting of hepatitis B. Its impact is very significant. It's the most aggressive form of viral hepatitis. And those patients who have hepatitis D have a high risk of progressing on to cirrhosis, as you can see there, at nearly up to 70% as compared to 30% of those who only have hepatitis B. The way to prevent and treat hepatitis B and hepatitis D co-infection is to remember that hepatitis B vaccines can prevent both viruses in patients who are not already infected. So this is the most important way for us to prevent this infection. Once you're vaccinated, it can provide protection from these viruses. Treatment for hepatitis B and hepatitis D co-infection will require the input of a healthcare provider. But in general, there are limited therapies for hepatitis D, but there are multiple therapies for hepatitis B. Therefore, please see your healthcare provider if you have hepatitis D co-infection.
The incidence of hepatitis B and HIV co-infection is estimated at 10%. HIV has a significant impact on the natural history of chronic hepatitis B infection. Compared to monoinfection, co-infection results in increased hepatitis B virus levels, accelerated progression of liver disease, increased liver-associated mortality, and overall morbidity and mortality. Antiretroviral treatment targets both HIV and hepatitis B and has led to significant improvements in clinical outcomes. So if someone is already receiving effective antiretroviral treatment that does not include antiviral activity against hepatitis B, then their treatment regimen should be changed to include the specific therapies that are also effective for hepatitis B. The figure on the left shows that men who have sex with men and persons who inject drugs are more likely to have hepatitis B and HIV co-infection compared to those high-risk persons who are heterosexual. The figure on the right illustrates how HIV and viral hepatitis B or C co-infection increase death from all causes, as well as liver-related and AIDS-related death compared to HIV infection alone. Though when someone is infected with all three, meaning HIV, hepatitis B, and hepatitis C, liver-related death seems to overtake AIDS-related death. Reducing the disease burden is really important to improve patient outcomes. Dr. Ahn, what are some steps that patients with hepatitis B can take to reduce the disease burden of these infections?
Yes, thank you, Dr. Tang, for reminding us that it's important for patients with hepatitis B to speak with their healthcare providers to make sure that they've been tested for hepatitis A, hepatitis C, and hepatitis D, as well as HIV. And for those patients who have hepatitis B, if they have tested negative for hepatitis A, they should be vaccinated to prevent infection with hepatitis A. In addition, for those household contacts or individuals who live with patients with hepatitis B, they should be tested and recommended to be vaccinated for hepatitis B to protect them from acquiring hepatitis B. In addition, if you are a patient with hepatitis B, you should have your hepatitis B virus levels and liver function tests routinely monitored and followed by your healthcare provider in order for you to have the best treatment effect and to monitor for side effects. Finally, once these medications are prescribed, it is vital that you take them as directed.
Thank you for the summary of reducing disease burden, Dr. Ahn. Now let's review the key takeaways from this talk. Hepatitis B infection may be accompanied by co-infections with hepatitis C, hepatitis D, or HIV. Co-infections typically increase the risk of liver cancer, progression of disease, severity of liver disease, and overall morbidity and mortality. So if you have hepatitis B, get tested for hepatitis A, C, D, and HIV. To view an animated whiteboard on additional information about hepatitis B, please go to this link, cmeoutfitters.com/HBV-patient-ED. I'm glad that you took the time to watch this video today. It is very important that you learn about your hepatitis B so you can optimize a healthy lifestyle.